and a pleasant good morning to everyone. This morning it's my task to share with you this special edition of our Health Emergency Operating Center's Situation Report. Yesterday afternoon, the Ministry of Health received 2 positive laboratory reports, that's COVID-19 laboratory reports, for 2 returning nationals who would have arrived in the Federation last Saturday, November 21st. So in essence, we have 2 additional imported cases of COVID-19. This brings the total number of confirmed cases of COVID-19 for the Federation to 22. The 2 returning nationals have been in quarantine since arrival. The protocols that we have established have been adhered to, and these protocols would have been followed along the corridor of containment between their arrival into the country at RLB International Airport and the hotel where they are staying. Contacts, meaning the significant contacts of these 2 cases, are presently being interviewed. The significant contacts are placed in quarantine, they are being tested, and they will be monitored. Our contact tracing system is quite robust here in the Federation. I want to also inform the general public that all passengers who would have arrived in the Federation on this same flight last Saturday afternoon, they are in quarantine and they are confined to their rooms. So let's just think about traveling and what happens. And so let's say you are booked to travel to St. Kitts, the Federation, via American Airlines or any other carrier. You would go to the international airport. You will be waiting in the departure lounge. And so you would interact inevitably with passengers who are going on the same carrier. And then once you are on board, you would be sharing the same air space, AIR space, with the passengers on board that 3-hour flight between Miami and St. Kitts and Nevis. Now, if you were to say use the restroom, other passengers on board also utilize the restroom. And then once you would have landed here in St. Kitts and Nevis, there is interaction between passengers when they are disembarking and when they are making their way through the RLB International Airport, through the health screening unit, through immigration, customs, and then as they exit the airport. And so as a result of this inevitable interaction, all passengers who were on board this conveyance, they have been asked to remain in quarantine, confined to their rooms while here or within the first 14 days of their vacation in the Federation. Now, as I said before, as at present, St. Kitts and Nevis, the Federation, we have reported a total of 22 confirmed cases of COVID-19. Now, the rate of infection, meaning COVID-19 infection per 100,000 population, now stands at 41.3. Now, this has increased from 37.6 yesterday when we were at 20 cases. Globally, based on the World Health Organization's COVID-19 dashboard, there are 58,712,326 confirmed cases of COVID-19 globally. The death toll internationally stands at almost 1.4 million. Based on the CNN COVID-19 tracker, in the United States of America, they've reported well over 12,421,000 confirmed cases of COVID-19 to date, and the death toll within the United States is really over 257,000. In the United States of America, they've noted a new record. The U.S. set another record for new COVID-19 cases in children, and that's last week. So this is coming out of the CNN. They noted that there were more than 144,000 new cases of COVID-19 reported among children in the week ending November 19th. The highest weekly increase since the pandemic began, according to an update Monday by the American Academy of Pediatrics. And so I just want to highlight that children are also impacted by COVID-19. And I also want to share with the general population that all children who come into our federation, we test them. All children, irrespective of age, they are tested. All right, so they go into quarantine, and in order for them to be officially discharged from quarantine, they are sampled and tested. So that's what pertains here in the Federation. What's happening regionally within the Caribbean region? The Caribbean region has reported 282,296 confirmed cases of COVID-19, and the death toll is almost 5,000. To be specific, it stands at 4,974. Closer home, let's see what's happening in the islands, the nearby islands. And so within the last 14 days, Antigua and Barbuda would have reported 14 cases, bringing their total to 139. Barbados would have reported 16, bringing their total to 259. Dominica would have reported 14 cases, that's newly confirmed cases, within the last 14 days, bringing their total to 77. St. Lucia reported 92 newly confirmed cases within the last fortnight, bringing their total to 223. St. Vincent and the Grenadines, 8. Grenada has a total of 41. And we see that Anguilla just had one newly diagnosed COVID-19 case within the past fortnight, bringing their total to 4. And that's, Anguilla went a few months without having any cases, and so this is a new case being highlighted in Anguilla. Testing, St. Kitts and Nevis, we continue testing all persons who would come into country, all returning nationals and international travelers. So to date, we would have tested over 3,674 persons. At present, we have over 303 persons in quarantine, and some are being quarantined at home, but with Commissioner of Police prescribed security. So to date, we have 19 persons recovered. We have a total of 22 confirmed cases. Please note that the last 3 cases that we are reporting, they are imported. They are imported from the United States of America, and at present, they are in isolation. Again, if you are interested or if you have plans to return to St. Kitts and Nevis or travel to St. Kitts and Nevis, you need to go to this URL or website, knatravelform.kn. You need to look at our health and travel protocols. We want you to be guided by same, and we want you to complete the entry form. Please note that in order to come or travel to St. Kitts and Nevis, you must submit evidence of a negative COVID-19 reverse transcription polymerase chain reaction test, PCR test, RT PCR test. Let me repeat, reverse transcription polymerase chain reaction laboratory-based molecular test. This is the gold standard, and this is the only test we will be accepting here on. So this is the official RT PCR test. We ask that this must be done at an accredited laboratory in the country from where you'll be traveling. We want you to take this test within 72 hours of travel and upload the results onto the entry form. Please note that COVID-19 PCR home tests will not be accepted. Please note the real-time PCR tests will not be accepted. Please note that tests or assays authorized by FDA under an emergency use authorization or EUA will not be accepted. So these are some of the many unacceptable COVID-19 test results that we have been encountering as we process the entry form. So in essence, I just want to underscore that in order for you to ascertain approval to enter the Federation of St. Kitts and Nevis at this time, you must submit evidence of a negative COVID-19 reverse transcriptase polymerase chain reaction laboratory-based molecular test result. You should also provide us with your hotel accommodation reservation, because these results and reservation will be verified before you are issued that official approval letter which is required for you to board any carrier bound or en route to St. Kitts and Nevis. Ladies and gentlemen, the COVID-19 outbreak in the United States of America continues to surge, and we continue to accept individuals coming out of the United States of America to our federation. And so by extension, the risk of importing or re-importing the COVID-19 virus continues to be extremely high. So what can you and I do to protect ourselves from COVID-19? Well, let's start with our frontline workers, those who work at the airport, those who work in terms of the ground transportation or taxi drivers, those who work on the sea taxi that takes individuals from St. Kitts to Nevis. We depend on you, or we are depending on you, to adhere to the established protocols. We want you to adhere to all of the COVID-19 protocols. You've been trained, and it's a new norm. And so we want you to be diligent and adhere to these protocols. And then you and I, we want you to adhere to the prevention and control measures for COVID-19. And these include wearing your face mask when in public spaces. This is very, very important, and it has proven to protect many thousands of individuals from the virus. So it's very important to wear your face mask and to wear it properly. The face mask must cover your nose and your mouth. Please, when interacting closely with anyone, or when interacting with someone closer than 3 feet, closer than 6 feet, it's important to have on your face mask over your nose and mouth. Your hand hygiene, very important. Remember to use hand sanitizing solutions before entering public spaces and when leaving public spaces. Always maintain that 6 feet distance between yourselves and others, and avoid mass gatherings and crowds. Very, very important. And so we have started tracing the contacts of case number 20. We've started testing them, and to date, none are positive. So what does that tell us? It tells us that the protocols that we have established are working, and it tells us that the frontline workers, they are adhering to these protocols, and we are imploring all frontline workers to continue their diligence in terms of adhering to the protocols that have been established. And so the public health team continues their contact tracing. As I said before, our contact tracing process is very robust. And so we will continue interviewing all the contacts of these imported cases just to ensure that everyone is okay. And we are doing this to protect all of us here in the Federation. Good news. I want to end on a positive note. Pfizer and BioNTech, they have applied for emergency FDA approval for the COVID-19 vaccine on Friday. So this submission took place last Friday, and they are hopeful that COVID-19 vaccines may become available as early as mid-December this year, 2020. And I suppose it goes without saying that the high-risk populations would be the ones who would be first in line for same. The research or the data so far tells us that this front runner, so this 162B2 vaccine is the front runner, and it's 95% effective at preventing COVID-19. So ladies and gentlemen, there is hope. Thank you.